listening to the SCV Connected podcast with my mom, Kelly O'Keefe.
She's the owner of Embrace Your Smile Orthodontics, 2 locations. One location is in Newhall and the other is in Valencia. She lives here locally in Santa Clarita and enjoys spending time with her friends, her family, and doing outdoor activities in her spare time. She attended Harvard School of Dental Medicine and went on to do orthodontic specialty training at the University of North Carolina. She has multiple publications in peer-reviewed journals. She also lectures other orthodontists across the country on specialized techniques on how to put braces on using digital systems. Welcome, Dr. Megan LeCornu.
Thank you. Thank you for having me.
Yeah, so we'll just jump right into it. What's one common myth that people might have about orthodontics when it comes to children?
It's really interesting because I have a lot of patients who come in and they seem to be kind of confused about the concept of early treatment.
Mm.
Back in our generation, and by my generation, I mean kind of what I like to call the elder millennials, if you will. Basically, 60% of patients were treated with extractions. And extractions were very common because we didn't do as much development of the arches or modification of growth. Instead, what we did is we kind of waited for all the permanent teeth to come in, and then we reacted to the crowding by taking out teeth to make space or correcting, let's say, an overbite using things like headgear. The
Yes.
thing, yeah,
I remember headgear.
yeah, like 16 candles. Who doesn't
Yeah.
love 16 candles?
Right?
But the thing is for a lot of people, for example, with like an overbite, the problem is in 80% of patients, an overbite is actually caused by a deficient lower jaw. And so when we were using things like headgear, we were actually retracting our upper jaw to a deficient lower jaw. And that's not ideal. That's not ideal for our tongue space, which then impacts airway. Or if we had severe crowding, instead of developing the arches, we basically extracted teeth and we retracted. And again, that also had an impact on our basically the space for our tongue, which then impacts airway. And then the aesthetic side effect of that was we flattened profiles, which actually ages our smile. So our
Wow.
generation, yeah, from our generation, we learned all of this very interesting information, and there was a lot of research that was done. And because of that, we started changing our philosophy. And now our philosophy is instead of like taking out teeth and retracting and constricting, we should really look at how we can develop the jaws to try to fit or keep as many permanent teeth as possible. So people come in and they say, "Oh my goodness, I see all these young kids in braces and I don't believe in that." And it's true. The true reality is only about 20 to 30% of the population needs early intervention. But there are 4 specific reasons in particular where we need to modify the growth of the jaws before the age of 10 and a half, ideally, to either, let's say, fix a crossbite, to increase space for permanent teeth, to change how teeth are erupting, or correct an underbite. Underbite correction
Mhm.
is really important. We address that before the age of 10 and a half. And that's because our upper jaw, the sutures of our upper jaw, they actually fuse around 10 and a half. So it's really hard for us to modify the growth after the age of 10 and a half.
Oh,
So
wow.
yeah, so early intervention, it's not like we see a child and they're going through that transitional dentition and we're like, "Oh, this doesn't look good. We should just put braces on them."
Right.
That's not the point.
Or it's not like my orthodontist is trying to make more money and put them in 2 phases.
Yep.
Okay.
And it is interesting because I was trained on the East Coast. So as you mentioned, my dental school training was at Harvard and we're a very research-based program. And then I got my specialty training at the University of North Carolina, which, is one of the top orthodontic programs in the country, which is also heavily research-based. So on the East Coast, I do notice that there is a little bit less phase 1 on the East Coast. On the West Coast, I do feel like people kind of like, "Oh, my kid's teeth are crooked and I think I should be in braces." And I do feel like maybe there are some offices that are maybe a little bit more aggressive in just kind of putting braces on people. But in our practice, it's more of a need-based treatment if we're treating before the age of 10 and a half, because we know that all the permanent teeth are not gonna be in that child's mouth, usually until 12 or 13. And so then we're gonna have to finish the bite correction. But interceptive treatment is needed for some people. So That's why the American Association of Orthodontics recommends that all children be evaluated by an orthodontist by the age of 7 or 8 so that we can make sure things are growing in okay. And if we have to intervene, we can. But for a lot of kids, they don't need early, interceptive treatment if they don't need it.
So, Dr. Megan, have you always wanted to be an orthodontist? Like, I picture you young playing, instead, most kids would play doctor or teacher. Were you
Yeah.
into dentistry? Like, or is this like something that was in your family? Like, how did you
Yeah.
get here?
So I was a very strange child.
There you go.
So my mom worked in a veterinary clinic, and at the age of whatever it was, like 6 or 7, I went to my very first take your daughter to work day. And so I gotta go to my mom's work and I gotta look in the microscope at like samples from the animals. And then there was one dog that they were doing teeth cleaning. And my mom let me help clean this dog's teeth. And I was like, I don't know, maybe 7 years old. And I looked at her and I was like, I'm gonna be a dentist. And she was like, okay, that's interesting. Well, you have your whole life to figure it out. So at 8 years old, I was in third grade and I interviewed my pediatric dentist about their career. And I presented my pediatric dentist's career to my class for show and tell. So I clearly wasn't the most popular child. Other kids were reading like toys and I was like interviewing about my dentist's career.
Oh my gosh, that's awesome. I love that though.
Yeah. And then, yeah, as I was going through school, I was kind of deciding between medicine and dentistry. So I did a pre-med route and I basically shadowed a bunch of different physicians, specifically female physicians and female dentists, and kind of got a feel for like lifestyle and work-life balance and also like the ability to really feel like you're making a difference. And dentistry is very, very artistic. It's very heavily reliant on basically your hand skills. And I loved art. So for me, instead of just kind of diagnosing things and prescribing medication, I really loved the idea of being able to use my hands and being very artistic in my career.
I have never heard of dentistry as an artistic endeavor. Like,
Yeah.
there's that element. I'm like, oh, I could just tell you're a true professional. Like, you love this. And just the way you're explaining it and to hear your passion. Oh my gosh.
It's an amazing career. I mean, I like to tell people, I really spend my life making people smile. And it's pretty cool because, there's studies that show the impact of a beautiful smile. So one of my favorite studies was from the Kelton Institute. And what they looked at is they basically did a HR study and they basically showed people who hire like high level professionals. And they took like your face and they took your face with beautiful straight teeth. And then a year later, they would show your same face, same outfit, but they had crooked teeth and they just photoshopped crooked teeth for straight teeth.
Okay.
Same resume. And they showed them like hundreds of these different applications. And they rated, okay, how would you rate this person on how hireable are they? How intelligent do you think they are? How smart do you think they are? How
Wow.
friendly do you think they are? And they found that just based on your straight teeth, there's
Oh, it's okay.
so just on your straight teeth, you were perceived to be, you're 146% more likely to be hired if you had straight teeth versus crooked teeth. You were
Wow.
perceived to be smarter. You were perceived to be nicer. So there
My
are so
God.
many interesting things that our smile does for us that we don't even realize. And, sometimes with my teenage patients, they don't fully understand like the gift that, having a beautiful smile is. I try to tell them, I'm like, look, this is one of the best gifts you're gonna have in your whole life because you're gonna wear your smile every day. Your
Yeah.
shoes, you're gonna get holes in them. You're not gonna be able to like fit in your shirt one day or it's gonna get ruined, but you're always gonna have your smile.
That's so true. Oh my gosh. I'm just like, I'll edit this out, but I'm so sad it's taken us this long to interview just because what you're saying, I just love everything about your heart behind this. And that is so true. You're instantly making positive change for people, and their smile is so important. Like you said with this study right now, this
And
is crazy.
seeing it in real life is so amazing. Like I'll have a kiddo who comes in, they'll smile to they'll like, oh, like I'll be like, hi, I'm Dr. Megan. And they're like, hi. And I'll be like, oh, okay. And then I'll ask them to smile like at the exam and they'll do this. And I'm like, no, 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 with your teeth. And you
Yeah.
can just tell they're like, and they're very quiet. They're very like, shy. And then suddenly you change that, right? And suddenly dad comes to me and he's like, well, now she's talking to boys and like, I'm not sure I'm ready for this. And like she's like very social now. And they come in like, hey, Dr. Megan. And And then I get like a card and it'll be like, thank you for what you've done. And for me,
Right.
it that's why, like, I don't know, it's cool because I do get to like have that impact in people's lives.
For
And I have
sure.
it on children. I get to have that impact on adults. And I always tell people too, it's never too late. My oldest patient is 92 right now.
Really? Oh
And
my
she
god.
always wanted it. She could never do it. And she's like, you know what? Like, what she said to me, she goes, I was always just so frugal with my money. She goes, then I realized I'm not taking it with me when I leave
Oh,
this.
yeah.
She's like, I always wanted these 2 teeth straight. And I was like, oh, let's do it. And so
Yeah.
she's just in a little 6-month treatment just to straighten a couple teeth, but she wanted it her whole life. And she comes into the office and she's like, I'm so excited to be here. And it's just like, it's very fun.
That's awesome. Oh my gosh. What would you say to people that might be interested in having a career in orthodontics?
So I actually have people who I have high school kiddos that will come and shadow me all the time because they're very interested in it. And what I always tell them is like, when you're pursuing a career in medicine or in dentistry, the biggest thing is you have to know you have to have really good grades. You're going to be I like to tell people you're going to be a professional student for a while. So it's about getting good grades. It's about working hard in school, getting involved in your community, doing research is really important. And honestly, following what you love, because then when you go off and you're in pre med, you might say, wow, I really wanted to do medicine, but I really love working with my hands. And then you start to gravitate towards maybe more of a dental type career. And then you go to dental school and you may go into dental school. When I went into dental school, I thought I wanted to be an oral surgeon. And I was 100% certain I was going to be an oral surgeon. I loved the idea of surgery. And then I went to a few OR surgeries and I realized the personality of the surgeons, they were like, one surgeon was like, I don't really care what their favorite color is. I don't really care where they're going to prom. I just put them to sleep, take out the teeth. And I was like, oh, but I kind of want to see the prom pictures. Like, I don't like those things.
Right.
And then I'm sitting in the clinics, the dental facial clinics, where we work up surgical cases. And I started realizing the orthodontists were like the engineers of the treatment plan. We
Mm.
set up the teeth to design how far, like, let's say, a surgical lower jaw advancement would be. And the surgeons do the advancement, but we are the ones who dictate how big that advancement would be and what the final aesthetic look would be. And I was like, oh, I want to be in control of what that is going to be. I want to design the facial like outcome. So I had no idea I was going to go into a field of orthodontics, but in dental school, I just started gravitating towards it because I started loving that.
Mm.
And so yeah, so just follow what you love. And if you follow what you love, always, you know, our career, there will be days where it feels like work, but if you follow what you love and it becomes a passion, it's really not work. It's your career. And yeah, there's rough days, but honestly, if you love it, most of the days are going to be amazing.
That's so true. And anything that you do, like if
Anything.
you love it, it won't feel like work as much.
Yep, exactly.
Oh. So what do you do for work-life balance? I would imagine like this could consume you as not just like you own two offices, so you wear the specialty hat of being the doctor, but then also like the business owner.
Yep.
What's that like? How do you
So
yeah.
work life balance is something I really had to learn. A lot of doctors, when they graduate dental school and residency or even med school, we are not given any business training. So we go out to the world, and some doctors work for a group, and some doctors end up in private practice and own their own practices. I found out that I really love owning a practice. And the reason I love owning a practice is because I get to make the choices on what type of appliances I use. I get to choose on how I treat my patients. I get to make the choice on the culture. And what I really found is I love empowering my team. I have an amazing team. I love watching them grow. I love, helping them achieve their goals. I have one assistant, for example, who always had a dream of becoming a hygienist, so really like supported her on like getting into dental school and going and pursuing a career in hygiene. I have another assistant who really always wanted to have his own business and doing like lab work. He's got amazing hand skills. So working with him right now to create his own business for his own dental lab. So it's very like I really found that like for me that has been a passion. And finding that work-life balance in the beginning is very hard but so important. I am a very big outdoorsy person. I love my family. I have 2 dogs I adore. And so I am someone who I like to say I work hard and I play hard. So
Okay.
I have my time at office and I do everything I love. And then I go into my life and I'll go on backpacking trips. I hike 14,000-foot mountains. I go snowboarding.
Oh my gosh, that's
Yeah.
awesome.
I love like high energy sports. And so work hard, play hard is like kind of my mantra. And that's also how I de-stress. So
Wow. That's awesome. Yeah, I could tell from your Instagram. I was like, it looks like you're just really active and I think you were snowboarding. I'm like, oh my
yes,
gosh.
lots of
That's great.
snowboarding. Yep.
That's so good. Let's see, what's one important lesson that you've learned just about your career in general?
So I think one of the big things is it can be very hard as a healthcare provider and as a practice owner to make everyone happy. A
Really? I feel like you definitely make everyone happy.
I try, but
But
a good
maybe like the insurance side too. I guess you have like that kind of the nitty gritty, like finances,
yeah,
insurance, like
insurances are challenging. Insurance has changed dramatically even during my time in practice. And, it's hard because sometimes insurance, you have someone sitting in a cubicle with no medical background and they're actually dictating treatment. I had a patient with cleft lip, cleft palate who was denied a treatment. And because the insurance was like, this is aesthetic. And it's very heart wrenching. So we have to work really hard to try to balance that. And then another good example is schedules, right? It's hard because we have some procedures that are long and it takes a lot of doctor time. And we try to schedule those in the morning. But as you know, it's very hard to get your child out of school. And so
yeah.
we really try to accommodate everyone and try to make it so that most of our patients can have after school appointments. But we can't do everything after school because some of our long appointments we have to do kind of during the morning to try to help make it so that we can optimize after school appointments and more people can have after school appointments. And some people can get really frustrated. They're like, my kid can't miss school. And unfortunately, the schools here, they're actually funded by attendance. And it's actually not okay. It's against the law, actually, for them to say that to punish a child for missing school for a medical appointment. So we
Oh,
give doctors notes, but I know that can be very frustrating for families because they don't want their kid to miss school. And so we try really hard to please everyone, but it's not easy. And we can't always do it. Another thing is like, let's say I have a kiddo. This happened actually yesterday. I had a kiddo come in with a really big emergency, like a trauma. And when that happens, you have to see that emergency patient, but it can back your schedule up. And
mm,
so now we're running a little bit late and people are waiting for their appointment. And we try really hard to see everyone on time. But if something like that happens, we can't always, be perfect because we do have to tend to like an emergency situation. And so for me, it's kind of, I'm a people pleaser and it's really stressful when I can't always please everyone or I'm running a little behind. So I think learning how to manage that has been a really big learning curve for me. Yeah.
wow, I'm so glad that you're just so honest and spoke to those two things. Because first off, I forgot that orthodontic treatment really is, and I know it used to be considered more cosmetic based. And so
Yep.
I forgot that that has to be stressful when people come in for consultations and then, insurance might kick back and say that it's not needed necessarily. Or like you said, in the waiting room, sometimes we're so focused on ourselves and our schedule as parents and where we have to get the kids to that we forget, like, if it's taking a long time, it's not just because the practice it runs like that. It could be like there's a trauma that came in. And
Yep.
yeah, I think sometimes we need to take that step back as parents too.
Yeah, I always try to notify 2 people, like, if because we really do try to we honestly, like, pride ourselves because 'cause I'm someone when I go to the doctor, if I'm waiting 45 minutes for my, like, 30-minute doctor appointment, I'm very frustrated.
Right.
So, like, I'm someone who really prides ourselves on trying to be, like, very cognizant of people's time and
Mhm.
trying to run our schedule on time, and that's something we pride ourselves on. But sometimes things happen, and I always try to tell families, I'm like, "I'm sorry I had an emergency come in," or "I'm so sorry." Another good example is, let's say, especially like during COVID, you have a staff member who's sick and you're
Oh my
running
gosh, yeah.
shorthanded. So now you're running shorthanded and you don't have enough staff to like so that can be very stressful and we're trying to still run on time, but we're short a person. And
Right.
so
Yeah, life
yeah.
happens. I'm so glad. But okay, so my experience, I've never had an appointment run, like sit in the office. late for one of the appointments. So
Yeah.
while we're talking about these things, they happen very rarely.
Yeah, they
But
do.
I love your like reward system. My daughter is always like, hurry, we got to get in on time. And so speak to that. Has that been something that you've always implemented, or do you find that kids respond well to that?
Yeah, so we just started doing that and I love it because we reward patients. One of the biggest things is good hygiene, right? So if they come in and they're brushing their teeth great, we always give everyone a grade A, B, C, D, F. And if they're getting A's or B's, they get points. They get points for coming on time. They get points for wearing their rubber bands really well. And so we try to reward them for doing the things that we need to give them a beautiful result.
Mm.
And I think it's been received so well. And if they get enough points, then they get to get a gift card, from wherever they choose. I think a lot of kiddos choose Amazon.
Nice.
It's funny. I get a lot of Best Buy requests, but that's been good because we're trying to make it a fun experience for them.
Right.
I feel like sometimes too, it's hard because especially with braces on, it's hard to brush your teeth. And so it's always like, negative, 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 like, oh, you're not brushing good enough. You're not brushing enough. But what if we flipped it and we said, if you're doing great, you get this. And so
Right.
then they're inspired and motivated to do really well.
That's so true.
Yeah.
Let's switch gears a little bit. Let's go back to business. What's like one of your productivity hacks? Like, do you have a time of day that you work best under? Like, get
Yeah.
things done, or yeah, tell me.
Well, I learned my favorite thing is seeing patients. Like, I like to see patients. That is my favorite. But when I'm running a business, I also have to have time to do the business things. For
Right.
example, administrative stuff, right? Or letters or meetings with referring doctors. So what I've learned is I have to set time aside. And so I ended up setting a whole day for administrative work. So my Mondays, for example, is my admin day. And my admin day is actually my busiest day. I'll have like 8 to 10 hours of work on my admin day. But I also have to time block. So sometimes I say, okay, I need to block this time on this day to just focus on these emails, or and I need to block this time on this day to focus on these things. So time blocking has been a really good thing for me as well. I feel like one of the blessings we have as women is we're really good multitaskers.
Yes. Yes.
And so I feel like being a woman in a field where you're a healthcare provider and a business owner is actually an amazing advantage because females, it's like, I don't know, I think we had to be created and we're genetically programmed to be we have to watch this kid run this way and cook dinner and do this and do that. So I feel like we're programmed to be multitaskers, which has been honestly a blessing for me and as I'm kind of going through my career. Yeah.
That's good. If you could choose any other career, what would it be?
Oh my goodness, someone asked me this the other day and I was
Really?
like, "Huh." I mean, it's kind of fascinating. I think I love medicine. So, I think if I wasn't in dentistry, I'd probably still be in medicine and I would probably be in like a plastic surgeon or
Really?
yeah, I do love surgery actually. So, even in our office, like one of the procedures we do is called a gingivectomy and we do it with a laser.
What is
Yeah,
that?
it is one of my most favorite things to do. It's so rewarding. So you use a laser and you kind of shape the gums. And it's kind of like when you do a case, for me, it's like the icing on the cake. Because, like, let's say someone has a gummy smile, just a little reshaping of the gums, it makes the teeth look bigger, it makes the smile look bigger. And I honestly love some of those aesthetic things. Again, I love art. So I do oil painting as a
Oh my
hobby.
gosh.
Yeah.
Really? Wow.
Yeah. So I love that. So I think I'd probably do like be a plastic surgeon or a dermatologist doing a lot of aesthetic work just because for me it's very rewarding to like see someone honestly feel great about something you do. But that's why honestly orthodontics is so amazing because you're doing something that functionally has a benefit. I mean, when you change a bite, I have patients who come in with TMJ problems and it's just because their bite is constricted. So we do a little bit of change in how the bite's coming together. And then I always do aesthetics. Like even if they're just coming in for a functional problem, I'm like, I'm going to bring your teeth down, make your smile look bigger and do these things. But we're really doing this for your jaw. But if we're doing it, we might as well make these aesthetic changes as well. And that's why I think my career is great for me because I get to do both. I was a molecular biology biochemistry double major and a physics and psychology minor.
Oh
So
my gosh.
the physics of like orthodontics is so fun. There's a lot of biomechanics. Yeah.
Oh my gosh. You could just tell your heart is in the right place. Like you were meant to do this.
Yeah, I think so. And, it's funny too, because people say to me, like, one of the things, oh, like, for example, right now, I literally this week have two patients moving to Tennessee, both of them. They don't know each other. Everyone's living in California right now.
Yeah, I know they are.
But, but they say to me, like, how do I find an orthodontist where I'm going? And I'm like, it's one of those things where I would talk to your dentist. I would ask them, like, who did you send your children to?
You.
Mhm.
Good one.
Your family too. And then another thing is there's a website. It's called the American Board of Orthodontics. You can get on that website and you can see which orthodontists are actually board certified. You think that all orthodontists are board certified, but board certification is actually very challenging. And so not all of us are. It as of a couple years ago, only 25% of orthodontists were actually board certified. But what board certification means is it means we have gone through a rigorous, like, basically testing process to make sure we can treat cases out to the highest level of standards that the board recognizes. So I always really encourage people to just go on there, try to find an orthodontist who's board certified. If they're board certified, they have high quality results. And then, go on, obviously look at their reviews and then talk to the dentist and then go in and meet them. And I'm actually someone who is a huge, huge like supporter and proponent of getting multiple opinions.
Really?
I
I'm so glad you're mentioning this because as a mom, you're like, where do you start with this?
Yeah, get multiple opinions. If it
Okay.
was me, like I want at least two or three opinions.
Right.
And the reason is this. It's because we're artists. So
Mhm.
like it's not just the clinical care that we do. It's the artistic side of how we treat out a case, right? Some doctors really just focus on the function and they're not really doing what's called a face forward approach. There's an orthodontist that was actually at the University of North Carolina. His name's Dr. David Sarver, and he kind of invented this concept of, hey, start with the face and work backwards. And so me and Dr. Weber, the other doctor in our practice, we were heavily influenced by Dr. David Sarver and also Dr. Profit. And we really treat everyone by using the face forward approach. And because of that, that's why I worked with 3M and I helped develop a process called digital indirect bonding. So,
What
what
is
we
that? Hold us in.
Yes. Yeah. So what we do is when I started my practice, there's a technique for putting braces on. It's called indirect bonding. But the old way of doing it was very challenging, very technique sensitive.
Yeah, I remember like the light would have to like free, like you'd have to put the light on so the cement like would harden on the
Yep.
rings. And when I took my daughter in there, there's like a whole digital scan. I was like, oh wow, it's come so far.
Yeah.
And I was like
It's
a headgear kid. I'm like,
Oh, were you? Oh, yes.
I
Oh,
love
good thing. You were tortured.
I know. Looking back, I'm like, how do I even sleep with this wire like sticking out of your face?
Your mouth? Yeah.
No.
Yeah, so what we do now is we reverse engineer our results. So what I mean by that is I look at like a face, like your face, let's say, and I basically will have a computer screen and I have your x-ray on one monitor, I have your smile like on the other, and then I have a digital setup, a mold if you will, digital model that I can turn around of your teeth. And I basically determine based on your smile where I want your teeth in the smile first. Then I work backwards to get the bite where I need it to be. And I position the braces, or if we're doing like an aligner setup, I determine the programming of how the aligners are going to move the teeth based on where I want your smile. So what we do is we're reverse engineering it. That's what digital indirect bonding does. So that's why I've been working with 3M and I actually do lecture around the country to other orthodontists on how to do this technique because it's more precise, it's more accurate. The results are just gorgeous. And it's easier for the kids. Back in the old day when you and I were going through this, it was like have your mouth open for like an hour to 2 hours. And
Yeah.
you're just sitting there and the doctor's positioning the bracket one by one.
Hmm.
And you imagine it, that's very hard clinically because the child's moving around.
Oh
The
my
the
God.
braces, if they get any saliva on them, it's contaminated. So they're wiggling around. You're trying not to let any saliva get on it. And you don't have a picture of the patient's smile there. So you're just putting the braces on where our standard positioning should be. And then you're reacting to that position as the patient's going through treatment. So like you're making bends in the wire and you're reacting instead of being proactive, instead of reverse engineering it and knowing that everything is set up to where you want it to be with the end in mind. And so now, when someone comes to our office, getting a full set of braces on, It's done under an hour. Our fastest time ever was actually 14 minutes because
Stop. Oh my
yeah,
gosh.
because the technology is just so amazing, and so they don't have to have their mouth open forever. Their jaw's not getting tired. They're not wiggling around. My patients who are on the spectrum, if they have autism or they have special needs, we can treat them the same as we can any other kiddo because the process is so easy.
You mentioned that you had an older patient, like what, 98 years old, and you do all the
92,
way to
yeah.
kids?
Yeah.
That's great. And then even if kids have like a special need,
We have a lot of ADHD kiddos.
sure.
I'll see him squirming around in the chair, and I'm like, "Okay, like, we are very excited about indirect bonding with this child."
Yeah. Or just like anxious adults, I'm sure too, like
Yep.
for dental care. Okay. Great. Well, I want to respect your time as well. Is there anything that maybe we didn't mention or
No, I mean, I just think as, busy mom like, here's the
Mhm.
thing, nowadays, my opinion of, like, the way our life is, we are busier than ever before. Our kids are so involved. They're in multiple sports. They're in multiple activities. We're running around trying to get them to where they need to be. So, when you're about to if your child need orthodontic treatment, I think the biggest thing is realizing, okay, you have to realize this is a process. It's not just a 2-visit situation. It's gonna be usually a year or 2 years or maybe 2.5 years of visits. And so you need to find an office where you're like, "Okay, I'm gonna be involved with this office for 2.5 years." And then you're gonna follow them in retainers, so that's another 2 years of retention follow-up. And you have to find a home that feels right because there's so many different, like, cultures in the office, there's so many different doctor personalities, and there's so many different, like, ways that offices run. So you need to find an office that fits you and that you're confident that you're going to be able to get the result that you want for you or for your child, and that you're also going to have like an enjoyable experience for that time. So
that's so
definitely,
true. I'm
yeah,
so glad you mentioned that. That's where it is. You need to find a home that you feel comfortable with because like you said, you're going to be with that office, that practice for a while.
yeah. It's funny when I have like a young kiddo, like who needs treatment, like an 8-year-old, and they need early interceptive treatment. I look at them, I'm like, we're going to be friends for a long time because
Yeah.
I follow them all the way until they're in college, and so
Oh my gosh.
it's a journey. And so I like everyone to know, just know that this is going to be a place that you're going to be at for a while.
Oh. Okay, so Dr. Megan, where can guests find you? If anyone's listening today and wants to reach out for a consultation, is it best to go to like your Instagram or a website or just
Yeah,
call?
so they can go to our website. It's
Okay.
www.embraceyoursmile.com.
Mm.
And we also have an Instagram, which is just embrace_your_smile. They can follow us there if they ever want information about different types of treatment or look at kind of before and after results. We post things there. And then our phone number is 661-259-2388, so they can give us a call. And all of our exams are complimentary because, again, we just believe it's good to get the information. And we do encourage like multiple opinions. So that's why we do complimentary exams.
Very cool. Well, thank you so much. And I'm sure we'll talk soon.
Thank you, Kelly.